Hey, what up? This is the lecture for Chapter 2, The Human Body in Health and Disease. Let's get started. This chapter we're going to cover anatomic reference systems, cytology, which is the study of cells, chromosomes, DNA, and genetics, histology, study of tissues, which are composed of a lot of cells. We have glands, which are specialized cells secreting material used elsewhere in the body. We'll look at organ and body systems, which is a lot of tissues and glands composed together to make up lots of organs that support each other, and pathology, which is the study of structural and functional changes caused by disease. We have 7 objectives for Chapter 2. Number 1, define anatomy and physiology and use anatomic reference systems to identify the anatomic position, body planes, directions, and cavities. 2, we're going to recognize, define, spell, and pronounce terms related to the abdominal cavity and peritoneum. 3, we're going to recognize, define, spell, and pronounce the terms related to the structure, function, pathology, and procedures of cells, tissues, and glands. Number 4, define the terms associated with genetics, including mutation, genetic engineering, and genetic counseling. 5, we'll differentiate between genetic and congenital disorders and identify examples of each. 6, we'll identify the body systems in terms of their major structures, functions, and related word parts. And finally, 7, we'll recognize, define, spell, and pronounce these terms related to the types of diseases and modes of disease transmission. Key word parts and key medical terms are all available on page 19. These are great for making flashcards or to review to see how much as a percentage of the chapter do you know and help you review prior to the test. Anatomic reference systems are used to describe the location and functions of body parts. These reference systems include body planes, body directions, body cavities, and structural units. Anatomic position is a position that everyone can start in, so when we give different directions or different planes, everyone's on the same page so we know what we're asking for. Anatomic position, you start standing straight up, you face forward, you hold both your arms at your sides, and you turn your hands with your palms facing front. If you'd like to see a picture of this, there's a woman in anatomic position on page 20 in figure 2.1. First, we have the difference between anatomy and physiology. Anatomy is the study of structures of the body. Physiology is the study of functions of these structures. Body planes are imaginary vertical and horizontal lines that are used to divide the body into sections for descriptive purposes. We'll talk about 3 vertical planes and 1 horizontal plane. A vertical plane is an up and down line that is at a right angle to the horizon. The mid-sagittal plane, also known as the midline, is the vertical plane that divides the body from top to bottom into equal left and right halves. A sagittal plane is any vertical plane parallel to the midline that divides the body into unequal left and right portions. The coronal plane, also known as the frontal plane, is any vertical plane that's a right angle to the sagittal plane that divides the body into anterior and posterior portions. So it'll divide you into front and back. A horizontal plane is anything that's horizontal like the horizon. So it's also known as a transverse plane. It divides the body into superior and inferior portions, so top and bottom portions. The transverse plane can also be at the waist or at any other level across the body. The relative location of the whole body or an organ is described through the use of pairs of contrasting body directional terms. These terms are summarized in Table 2.1 and are illustrated in Figures 2.1 through 2.5. We've got anterior, meaning front, also known as ventral. We have posterior, meaning back, also known as dorsal. We have superior, meaning uppermost, above or toward the head. We have inferior, meaning lowermost, below or toward the feet. We also have towards the head cephalic, and towards the body, or towards the lower part, towards the tail, caudal. We also have a few terms that mean closer and away, such as proximal, meaning nearest the midline or closest to the beginning of body structure, and the opposite of that would be distal, meaning farthest from the midline or away from the beginning of body structure. We also have medial, which means towards the middle direction or near the midline, and lateral, meaning away from or towards the sides, so away from the midline. Now let's discuss major body cavities. A body cavity is a space within the body that contains and protects the internal organs. The dorsal cavity, which is divided into two parts, protects the structures of the nervous system that coordinate the bodily functions. The cranial cavity, located within the skull, protects the brain. The spinal cavity, located within the spinal column, protects the spinal cord. Next, we have the ventral cavity. The ventral cavity, which is divided into three parts, contains many of the body organs that maintain homeostasis. Homeostasis means maintaining a constant internal environment. The thoracic cavity, also known as the chest cavity, protects the heart and the lungs. The diaphragm is a muscle that separates the thoracic and abdominal cavities. The abdominal cavity, which contains primarily the major organs of digestion, frequently is referred to simply as the abdomen. The pelvic cavity is the space formed by the pelvic or the hip bones. It contains primarily the organs of reproductive and excretory systems. There is no division between the abdominal and pelvic cavities. Together they are referred to as the abdominopelvic cavity. Describing where an organ or a pain is located is made easier by dividing the abdomen into four imaginary quadrants. Quadrant means divided into four. These are the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant, each abbreviated with the first letter of the quadrant. Another descriptive system divides the abdomen and lower portion of the thorax into 9 regions. Check out figure 2.8, which is on the lower part of this slide. The right and left hypochondriac regions are located on the sides and are covered by the lower ribs. The term hypochondriac means below the ribs. It also means an individual with an abnormal or excessive concern about his or her health. The epigastric region is located above the stomach. The right and left lumbar regions are located on the sides near the inward curve of the spine. The umbilical region surrounds the umbilicus, also known as the belly button or navel. The umbilicus is the pit in the center of the abdominal wall, marking the point where the umbilical cord was attached to the fetus. The right and left iliac regions are located on the sides over the hip bones. And finally, the hypogastric region is located below the stomach. The entire lower region of the abdomen is also referred to as the groin or inguinal area. The peritoneum is the membrane that protects and supports the organs located in the abdominal cavity. The parietal peritoneum is the outer layer of this membrane that lines the abdominal cavity. Parietal means cavity wall. The visceral peritoneum is the inner layer of the membrane that surrounds the organs of the abdominal cavity. Visceral means relating to the internal organs. The mesentery is the layer of peritoneum that suspends parts of the intestine within the abdominal cavity, so it doesn't shake around. The term retroperitoneal means located behind the peritoneum of the abdominal cavity. Peritonitis is an inflammation of the peritoneum. Ascites is an abnormal accumulation of clear or milky fluid in the peritoneal cavity. Laparoscopy is the visual examination of the interior of the abdomen with the use of a laparoscope. Laparoscopic surgery involves the use of a laparoscope plus instruments inserted into the abdomen through small incisions. You can use these to explore and examine the interior of the abdomen, take specimens to be biopsied, or perform surgical procedures. Cells are the basic structural units of the body that are specialized and grouped together to form the tissues and organs. Cytology is the study of the formation, structure, and function of cells. Cyto means cell, and ology means study of. The cell membrane is the structure that surrounds and protects the cell. A membrane is a thin layer of tissue that covers a surface, lines a cavity, or divides a space or organ. Cytoplasm is the material within the cell membrane that is not part of the nucleus. Cyto meaning cell, and plasm meaning formative material of cells. The nucleus which is surrounded by the nuclear membrane, is a structure within the cell that has two important functions. It controls the activities of the cell, and it helps the cell divide. The nucleus of each cell contains 46 chromosomes, arranged into 23 pairs. There are 22 identical pairs, plus a single pair, double X or XY, that determines the sex of a child. Sex cells, sperm and ovum, also known as gametes, are the only cells that do not have 46 chromosomes. Instead, each mature sex cell has 23 single chromosomes. When a sperm and ovum join to form a new life, the embryo receives half of its chromosomes from each parent. Chromosomes are organized as two long coiled molecules of deoxyribonucleic acid, which are commonly referred to as DNA. Genes are the functional units of heredity. Each gene is a segment of DNA that is located in a specific site on a chromosome. Each chromosome contains about 100,000 genes. The genes in DNA create a unique pattern for each individual. That pattern can be used to identify the source of a tissue specimen. The unique nature of this pattern makes DNA evidence useful in some court cases. Genetics is the study of how genes are transferred from parents to their children and the role of genes in health and disease. A specialist in the field of genetics is known as a geneticist. Genetic engineering is research to identify defective genes and to develop gene therapy to treat or replace faulty genes. The term genetic mutation describes changes that occur within genes. Somatic cell mutation is change within cells of the body. These changes affect the individual but cannot be transmitted to the next generation. Gametic cell mutation is change within the genes found in the gametes that can be transmitted by parents to their children. Genetic disorders, also known as hereditary disorders, are diseases or conditions caused by a defective gene. Although these genes were transmitted from the parents, a genetic disorder may be manifested at any time in life. There are more than 2,000 known genetic disorders affecting all the body systems. Cystic fibrosis, which is discussed in Chapter 7, is a genetic disorder of the exocrine glands. Down syndrome, also known as trisomy 21, is a genetic disorder caused by the presence of all or part of the third copy of chromosome 21. It's usually associated with physical growth delays, mild to moderate intellectual disability, and characteristic facial features. Hemophilia is a group of hereditary bleeding disorders in which one of the factors needing to clot the blood is missing. Genetic transmission is from mother to her son. Huntington's disease is a hereditary disorder with symptoms that first appear in midlife and cause the irreversible and progressive loss of muscle control and mental ability. The HD gene, which can be detected through genetic testing, is a dominant gene. That means that there's a 50% of people inheriting it will develop the disease. Muscular dystrophy is a group of genetic diseases characterized by progressive weakness of muscle fibers. We're going to look at a few more examples of that in Chapter 4. Phenylketonuria is a genetic disorder in which essential digestive enzymes are missing. PKU can be detected by a blood test at birth. If not detected and treated early, PKU can cause severe mental disabilities. Sickle cell anemia, which is discussed in Chapter 5, is a serious genetic disorder caused by genes that produce abnormal hemoglobin in the red blood cell. Tay-Sachs disease, also known as TSD, is a hereditary disease marked by progressive physical degeneration, mental disabilities, and early death. The transmission of genetic disorders is a complex game of chance, and genetic counseling is a valuable tool for persons concerned about genetic disorders. The following example describes the possibilities of transmitting sickle cell anemia. An individual with sickle cell anemia has only genes for abnormal hemoglobin. If both parents have this disorder, they will both pass this gene to their children, and the children will also have sickle cell anemia. An individual with sickle cell trait does not have the disease sickle cell anemia. However, he or she does have one gene for sickle cell anemia and one gene for normal hemoglobin. As shown in Figure 2.11, although the potential parents with sickle cell trait are healthy, they are carriers and can transmit the disease to their children. A congenital disorder is an abnormal condition that exists at the time of birth and may be caused by a developmental disorder before birth, prenatal influences, premature birth, or injuries during birth. A developmental disorder may result in an abnormality or malformation, such as the absence of a limb or the presence of an extra toe at birth. An anomaly is a deviation from what is regarded as normal. Prenatal influences are the mother's health and the care she receives before delivery. For example, maternal alcohol consumption during pregnancy can cause the congenital disorder fetal alcohol syndrome, which is also known as FAS. FAS is characterized by prenatal and postnatal physical and behavior traits, including growth deficiencies and abnormalities, mental deficiencies, brain damage, and socialization difficulties. Birth injuries are congenital disorders that were not present before the events surrounding the time of birth. As an example, cerebral palsy, CP, which is discussed in Chapter 10, may be caused by premature birth or be due to inadequate oxygenation to the brain during birth. A tissue is a group or layer of similarly specialized cells that join together to perform certain specific functions. Histology is the study of the structure, composition, and function of tissues. Histo means tissue, and ology means study of. A histologist is a specialist in the study of cells and microscopic tissues. Stem cells are also known as precursor cells, and they're really cool cells. They have the ability to divide without limit, and they give rise to specialized cells. They're abundant in the fetus and in the cord blood of a newborn, but they're not really there for adults. Each type of tissue has its own type of stem cells, and when implanted into appropriate type of tissue, the stem cells can regenerate the whole range of the cell types that are normally found there. The research goal is to discover how to use stem cells as a source for organ and tissue regeneration. Some applications, such as bone marrow transplants, are already in use. We're going to find out more about that next chapter. The four main types of tissue are epithelial, connective, muscle, and nervous. Epithelial tissues form the protective covering for all your internal and external surfaces of your body. Epithelium is the specialized epithelial tissue that forms the epidermis of the skin and the surface layer of your mucous membranes. We're going to talk about the skin more in Chapter 12. Endothelium is the specialized epithelial that lines the blood and the lymph vessels, body cavities, glands, and organs. Glands are made up of specialized epithelial tissues that are capable of producing secretions. Connective tissues support and connect organs and other body tissues. Bone, cartilage, and other dense connective tissues we're going to talk about in Chapter 3. Adipose tissue, also known as fat, provides protective padding, insulation, and support, and acts as a nutrient reserve. Adipo means fat, and os means pertaining to. Loose connective tissue surrounds various organs and supports both nerve cells and blood vessels. Blood and lymph, we're going to talk more about in Chapter 5 and 6, are liquid connective tissues. Muscle tissue, which we're going to talk about in Chapter 4, contains cell material with a specialized ability to contract and relax. Nerve tissue, which we're going to talk about in Chapter 10, contains cells which are specialized in the ability to react to stimuli and conduct electrical impulses. Pathology of tissue formation are terms that are discussed when your tissues don't form properly. Aplasia is a lack of development of organ tissue, so it doesn't grow at all. Hypoplasia is the incomplete development of an organ or tissue, but it is less severe than the degree of aplasia. So there's some, but not enough. Hyperplasia is the abnormal increase in the number of normal cells in the normal arrangement in a tissue. So that means there's more of the tissue than necessary. Dysplasia is the abnormal development of growth, especially of cells. So that means that it's disfigured or it's not working properly. Anaplasia is where cells change their structure and their orientation to each other and begin to grow abnormally out of control. We're going to talk more about that in Chapter 6, and it's usually relating to malignancy, which is a life-threatening tumor that tends to spread to distant body sites. A gland is a group of specialized epithelial cells that form secretions. A secretion is the substance produced by a gland. There's two types of glands, and those are exocrine and endocrine. We're going to check those out on figure 2.12. Exocrine glands, like sweat glands, secrete their chemical substances into ducts that lead either to organs or outside of the body. Exo meaning out of, and crine meaning to secrete. Endocrine glands, which secrete hormones, do not have ducts. Endo means within and crine means secrete. These secretions flow directly into the bloodstream for transportation to organs and other structures throughout the body. We're going to talk more about that in chapter 13. Sometimes a good gland can go bad, so let's look at the terms related to pathology and procedures of the glands. Adenectomy is the surgical removal of a gland. Adeno means gland, and ectomy means surgical removal. Adenitis is the inflammation of a gland. Adeno means gland, and itis means inflammation. Adenoma is a benign tumor in which the cells form recognizable glandular structures. Adeno means gland, and oma means tumor. Benign means it's not life-threatening. Adenomalacia is the abnormal softening of a gland. Adeno means gland, and malacia means abnormal softening. Adenosclerosis is the abnormal hardening of a gland. Adeno means gland, and sclerosis means abnormal hardening. Adenosis is any disease condition of a gland. Adeno means gland, and osis means abnormal condition. An organ is a somewhat independent part of the body that performs a special function or functions. The tissues and organs of the body are organized into systems that perform specialized functions. You can see this on figure 2.13. We're going to talk about the systems outlined in table 2.2 in a moment. So here you can see we begin with the organism at the very highest structure. Then getting smaller we have organ systems. So you have respiratory, nervous, digestive. In organ systems you have individual organs that compose those systems. Tissues are the things that make up organs. You have to have many cells to make tissues. Inside of cells you'll have organelles. Molecules are what make up organelles. And then you have atoms or ions that even make up molecules, and we can go smaller even still. Alright, starting at the top of page 30, we have major body systems. Starting off, we have the skeletal system. The skeletal system supports and shapes the body, protects the internal organs, forms some blood cells, and stores minerals. We have three different things that make up the skeletal system. We have bones. The word root for that is osteo. We have cartilage. The word root for that is chondro. And we have joints, where two bones meet, which are called arthro for their word root. Next, we have the muscular system. Muscular system holds the body erect, makes movement possible, moves body fluids, and generates heat. We have three different areas to focus on here. The fascia, connective tissue. The word root is fascio. We have muscles, the actual things that move us around. The word root for muscles is myo. And then we have tendons, which connect muscles. We have tendo, tendo, and tendono, as the word roots for tendons. Finally, we have the cardiovascular system. Cardiovascular system pumps blood that carries oxygen and nutrients to your entire body. It carries liquid waste to the lungs and your kidneys. We have four different parts. We have arteries. The word root is arterio. They carry blood away from the heart. You have blood with the word root hemo, and hemato. Blood is the actual connective tissue, the liquid connective tissue. We have heart, which is cardio, as the word root. That's the muscle portion of the cardiovascular system. And we have veins with the word roots phlebo, and vein, veno, as your word roots, and those are vessels that carry blood back to the heart. Next, we have the lymphatic and immune systems, which protect the body from harmful substances, bring oxygen and nutrients to cells, and remove waste from cells. The lymph vessels, and lymph nodes, thankfully, all have the same word root, which is lympho. Then we also have specialized blood cells, like white blood cells, which have a variety of word roots. We have the organ, the spleen, which helps filter our blood with the word root splen, spleno. It's also a reservoir. We have the regulatory organ, the thymus, which has the word root thyme, thymo. And we have the gland, the tonsils, at the back of our throat with the word root tonsil, tonsilo. The respiratory system brings oxygen into the body for transportation to the cells, removes carbon dioxide and some water waste from the body. The larynx, also known as the voice box, has the word root larynge, laryngeo. The lungs, which are large sacs so we can fill them with air, have the word roots pneum, pneumo, and pneumon, pneumano. The nose, which is filled with hairs to help filter air, has the word root nas, naso. The pharynx, also known as the throat, has the word root pharynge, pharyngeo. And the trachea, also known as the windpipe, has the word root trache, tracheo. The digestive system digests ingested food so it can be absorbed into the bloodstream, eliminate solids and wastes. We have the esophagus, which is the tube that connects our throat to our stomach, with the word root esophago. We have the large intestines, which help extract water and help us stay hydrated, with the word root colo. We have the liver, which helps secrete enzymes and filter our blood, with the word root hepato. We have our mouth, which ingests food and chews, with the word root oro. We have our pancreas, which helps digest sugars by secreting the hormone insulin. That word root is pancreato. We have the small intestines, with the word root intero, which help bring in proteins, fats. We also have the stomach, with the word root gastro, which helps bring in carbohydrates and helps break down foods. The urinary system filters blood to remove waste, maintains the electrolyte and fluid balance within the body. We have the kidneys, which help filter blood, with the word root nephro, or reno. We have the ureters, which connect your kidneys to your bladder, with the word root uretero. We have the urethra, which connects your bladder to the outside of your body, which is very similar to the ureter in the word root, urethro. So be careful on that. Then we also have the urinary bladder, which stores liquid until you're ready to void it, and then has two different word roots with cysto, and vesico. The nervous system coordinates the reception of stimuli, transmit messages to the body. The main control center is the brain, with the word root encephalo. To bring in sound stimulation, you have the ears, with the word root acousto, or otto. You have, for visual stimulation, the eyes, with the word roots oculo, or ophthalmo. The actual conduction system is used by nerves, which has the word root neuro, and that's transmitted from your central nervous system to your peripheral system via the spinal cord, with the word root myelo. Be careful that the word root myelo also means bone marrow. The integumentary system protects the body against invasion by bacteria, regulates the body temperature and water content. Sebaceous glands, with the root sebo, secrete secretions. Skin, with the word roots cutaneo, dermato, and dermo, cover the body to protect it from infection. Sweat glands, with the word root hydro, are in effect used to cool the body and reduce water content. The endocrine system integrates all body functions. The adrenals secrete adrenaline, which stimulates our fight or flight. That has the word root adreno. The gonads, with the word root gonado, are utilized in reproduction. The pancreas, with the word root pancreato, produces enzymes to help break down food. The parathyroids, with the word root parathyroido, use calcium to control pretty much everything in our body, and it also helps regulate our body temperature. The pineal gland, with the word root pinealo, we're not 100% sure what it does, but we're fairly certain that it controls sleep and maybe many more things. The pituitary gland, with the word root pituito. Pituito is a major control center. It controls hormones, reproduction, growth, breast milk, water balance, childbirth, a whole lot of our really important body functions. The thymus, with the word root thymo, is vital for our immune system and is our anti-cancer activator in our body. The thyroid, with the word root thyroido, uses iodine to regulate all of our body systems with guidance from the pituitary gland. And finally, the reproductive system produces new life. For men, the sex organ is the testicles, with the word root orco or orchido. For women, the sex organs are the ovaries. And that word root is ophoro, and ovario. The uterus, also known as the womb, is where a child will mature. We have the word root histero, metro, metrio, and utero. Pathology is the study of structural and functional changes caused by disease. Patho, and pathy, meaning disease. However, they also mean suffering, feeling, and emotion. Pathology also means a condition caused by disease. A pathologist specializes in the laboratory analysis of tissue samples removed at operations or post-mortem examinations to confirm or establish a diagnosis. A post-mortem examination is also known as an autopsy. Patho meaning disease, and ologist meaning specialist. Etiology is the study of causes of disease. Eti meaning cause and ology meaning study of. The organisms that cause disease are discussed further when we get to chapter 6. Now we're going to look at terms used to describe different types of diseases summarized in table 2.3. Bam! Table 2.3. We got types of diseases. An infectious disease is an illness caused by a pathogenic organism. So virus, bacteria, something gets inside of us and it's making us sick, and it can probably get to other people. An idiopathic disorder is an illness without known cause. Why'd you get sick? Well, I don't know. It's idiopathic. In an organic disorder, there are pathologic physical changes that explain the symptoms being experienced by the patient. For example, a gastric ulcer is an organic disorder. We're going to talk about that in chapter 8. For example, if you eat too many spicy foods, eventually you'll erode the lining of your tummy and you'll start getting an ulcer. So because of the environment, it's an organic disorder. A functional disorder, there are no detectable physical changes to explain the symptoms that are being experienced by the patient. For example, a panic attack is a functional disorder. We're going to talk about that more in chapter 10. An iatrogenic illness is a problem such as a side effect or an unfavorable response arising from a prescribed medical treatment. So we're going to give you this drug. We know that this is probably going to happen, but hey, it's better than what you were, taking the medication for. And a nosocomial infection is an infection that you acquire in a hospital setting that was not present on admission, but appears 72 hours or more after hospitalization, meaning we brought you into a hospital with a lot of sick people, and now you got the sick that was already here. Now let's talk about how diseases get around. A communicable disease is also known as a contagious disease. It's any disease that's transmitted from one person to another, either by direct contact or indirectly by contact with contaminated objects. Contaminated means the possible presence of an infected agent. Contamination may occur through a lack of proper hygiene standards such as hand washing or without taking proper precautions. Bloodborne transmission is through direct contact with blood or body fluids that are contaminated with blood. Examples include acquired immunodeficiency syndrome like AIDS and hepatitis. Bloodborne diseases are also transmitted through sexual contact. We're going to talk about those more in chapters 5 and 6. Sexually transmitted infections, also known as STIs and venereal diseases, require direct person-to-person contact or contact with lesions. We're going to talk about those more in chapter 14. Airborne transmission occurs through the respiratory droplets, such as contact with material from a cough or a sneeze. Examples include tuberculosis, influenza, cold, and the measles. We're going to talk a lot about those in chapter 7. Foodborne and waterborne transmission, also known as fecal-oral transmission, is caused by eating or drinking contaminated water or food that has not been prepared properly to kill the contamination. We'll discuss those in chapter 8. Alright, career time. First, let's check out epidemiologist. An epidemiologist specializes in the study of outbreaks of a disease within a population group. So they would start off at an endemic. An endemic refers to the ongoing presence of a disease within a population, group, or an area. For example, the common cold is an endemic because it's always present within the population. They would also go and respond to an epidemic, which is a sudden and widespread outbreak of a disease within a population group or area. For example, a sudden widespread outbreak of measles is an epidemic. Finally, we hope we would have a lot of epidemiologists around to handle a pandemic. A pandemic refers to an outbreak of a disease occurring over a large geographic area, possibly worldwide. For example, AIDS is a pandemic. Medical assistant prepares patients for exam, takes vital signs, medical history, performs basic lab tests, cleans and maintains equipment, may also fill an administrative role such as receptionist or office manager. Nurse assistant, nurse aide, patient care technician, orderly, provides basic and essential patient care such as bathing, bed making, feeding. We've got registered nurse, licensed practitioner nurse, licensed vocational nurse, state license to provide and manage patient care. An RN is authorized to provide specialized services including administering medications, teaching, supervising other staff. An LPN or LVN provides for patients' needs under supervision of an RN or a physician. Then there's many subsections of nursing including community health nurse, critical care nurse, flight nurse, hospice nurse, infectious disease nurse, IV therapy nurse, nurse anesthetist, private duty nurse, school nurse, surgery scrub nurse. We've got nurse practitioner, which is an RN with advanced training in the diagnosis and treatment of illnesses. A nurse practitioner provides primary care for patients, often in collaboration with a physician, and in some states, nurse practitioners may even write prescriptions. We have physician's assistants, PAs, which perform routine medical exams, diagnostic tests, and treat minor injuries and diseases under the supervision of a physician. And in many states, they can also prescribe medications. Then we also have medical translators, which provide bilingual assistance for accurate communications between healthcare providers and non-English speaking patients. A medical translator must know the medical terminology in English and a second language. And that is everything that I would like to share with you about medical terminology in Chapter 2, The Human Body in Health and Disease. Thank you so much for watching, and I'll see you in class. Be good people, do good things.